Glenn Taylor is my name. I was with Medco Health Solutions for 20 years and retired as group president of the health plan business, which was about a $50 billion segment, billion with a B, of Medco, and retired in 2012 when we sold the company to Express Scripts. Well, I think people that have been in healthcare for a long time, you've seen it all, but then you haven't seen anything, sort of. And that's really an important aspect of why we do what we do. It's important to feel that we're giving back and that we're helping people out, and we're doing it on as much of a population basis as we can. I think it's one of those, the more we know we don't know. And that's kind of the fun part of healthcare. We can continue to solve problems, we can continue to find solutions, and then there's going to be a bunch of other things that pop up that, wow, we just didn't even know or understand about that. And it's that process of discovery and the creativity and the solving of problems that I think has all of us very excited about what we're trying to do at Safe Harbor. Let's talk about the evolution and where it's going. And all of this is speculative, but I think that we're starting to see much more consumer involvement. So people are going to be interested in and managing their own benefits as opposed to some group managing it for you. And I think that's clear. I think the advent of bringing technology, whether it's telemedicine or bringing in medical records, electronic medical records, I mean, I think we're going to see that power of finally having interoperability, systems being able to talk to one another, so physicians and pharmacies and hospitals and everybody can know what this person's health status is. I think that's coming. It's not quite there. And I think one of the biggest impacts we're going to see is the whole genomic or genetic impact. All the studies have shown that there's tremendous value in understanding and knowing what's going to work for you in your unique genetic makeup. So for some people, Advil works and Tylenol doesn't and Aleve does, and we don't understand why. Wouldn't it be nice if we could eliminate all that guesswork and just find the right things for the person, that particular person, the first time? I think all of this improves patient outcomes. It brings additional value into the system. And that, I think, can only be good for everyone. Well, Safe Harbor was, I think, that perfect storm of a disruptive technology or technologies, a lot of smart people that are going to really make a difference. We're going to improve healthcare and bring greater value. You don't get those opportunities that often, and when you see that come along, you get excited. You get excited. That's what we all have done throughout our healthcare careers. Well, compliance it's not a given, but it's a non-starter if you don't have it. If you aren't compliant in this environment these days, you're not going to be in business. So I think that was really a brilliant, necessary prerequisite to the company. The research aspect is absolutely critical. We hear a lot of anecdotal things about healthcare, but to really do the research and really understand what the impact these medicines have on patients or potentially could have, I think, again, it's really a necessary step and a good first step for the company. So I think the spectrum of payers and physicians and patients and pharmacies and hospitals and bringing all of that together is really an important mission of Safe Harbor. And I think we're going to accomplish this disease by disease, step by step, but we're going to make those breakthroughs that heretofore just haven't happened in healthcare. And it's a very exciting place to be.